host, Amberlyn Carroll. Thank you for joining us on this episode of Medwatch today. Through the Heart and Lung Institute Community's system-wide approach to cardiac care, patients now have access to advanced heart care close to home. And recently, Clovis Community celebrated the completion of its first scheduled open heart procedure.
We're quite active as a family, my daughters and I, and so we worked out. We've done, CrossFit stuff. We've played sports, golf.
Active Valley resident Cruz was working out one day when he says he felt a weird sensation in his chest.
I was like, okay, maybe I shouldn't be running. I just felt not like a sharp pain, but just like felt like a string was around my heart, tugging, not something that was like scaring me.
He made an appointment with his doctor, but was still noticing problems with his blood pressure.
Trying to get my blood pressure down. I was having trouble, finding the right medication, so I changed doctors. I came to a Dr. Sundrani here in Fresno, and he did a CT scan.
And to his surprise, his cardiologist found something wrong.
And that's when they found a blockage. I had an angiogram with Dr. Sundrani, and he couldn't stent it, but it was completely blocked, so he couldn't do it. He recommended me to Dr. Khwaja. He said he was the best.
Cruz needed triple bypass surgery and was referred to Community's medical director of cardiothoracic surgery, Dr. Shamsuddin Khwaja.
We could be the most healthiest people, but having to know what our body's about and what it's doing is so important.
Community Health System recently expanded cardiac services to Clovis Community, something that Dr. Khwaja says will greatly improve access to heart care in the valley.
Just to think what the dream that's coming true. We've grown our heart surgery program to encompass 7 surgeons that work within the community system, and they are all very confident and very happy with the direction that community hospital system has taken. We're able to maintain the quality of care and do what we do best, and that's doing heart surgery in all 3 hospitals without compromising patient safety and quality and their satisfaction.
And by maintaining that quality of care, patients like Cruz can get back to living life once again.
What I'm most thankful for is the staff. Absolutely incredible.
And with his daughter by his side, Cruz came back to Clovis Community to personally thank Dr. Khwaja and the surgical team for saving his life.
Every person that I dealt with there was just amazing. They were so nice and kind and understanding, telling me, explaining things the way they were happening.
But the biggest lesson from Cruz's story is to listen to your body.
If there is a change in your breathing pattern, a change in the chest discomfort that's new, or maybe it's worsening, I think that's a telltale sign that something may be wrong, and re-engaging your cardiologist or your doctors would be very appropriate.